But Dr. Rachna Kucheria, this is interesting because on one hand, concerns about a kind of Omicron-fuelled COVID resurgence, whether it turns out to be deadly or not, but those are fears. Governments are enforcing all sorts of increased restrictions, quasi-lockdowns and so on. On the other hand, people are out and about. I mean, there are huge crowds gathering everywhere for markets, for bazaars, for political rallies as well. So is that a kind of strange paradox, and is that a worry?
It is a worry, and I'll speak from the point of view, you have all the experts here, of a practicing public health physician. The time is not to be, complacently optimistic. It's to be very cautiously optimistic, and at best, if we weren't that, we'd be foolhardy. The data is coming in. It's very little. We've got 3 or 4 studies to bank upon, but it is showing, like you said, and I'll give it a slightly different spin, like you said, 2 to 3 to 5 times more transmissible, this Omicron. And if it's even, let's say, half or 1/3 the severity, we're still talking about 1.5 times more cases. If you add the two together, it's going to spread faster. And in a pandemic, we've already seen this happen. When this happens, any country, most countries, systems will get overwhelmed quickly. So I think it's a bit foolhardy now. Everybody had a break. I'm just going to talk very simplistically. There was pandemic fatigue. Everybody had a break. And I think so that people's livelihoods are not affected, this is the time to roll up your sleeves and cut back, move back. We already know what is to be done. Masks did work. The booster shot is being rolled out. Get the second shot if you haven't done so already. And one other point I'd like to really make is, since we already know from the data coming in from other countries that it's about 2 to 3 to 5 times more transmissible, I think what needs to be done and thought of at this stage, as much as oxygen and hospital and all of that, I'll speak from the community perspective. How are you going to isolate people at a community level? And I'm not talking about those who have 2 or 3 rooms in their homes. I'm talking about the masses of India where people live in one dwelling. How are you going to separate out those who will be at risk, the older elderly, or those with comorbidities, from those who are getting the transmission, because this is going to really transmit fast. So those are things we need to focus right now and not dawdle, I would say.